I want to get into the macro for a bit, but as our viewers who follow me on Twitter or LinkedIn know, I've been kind of diving into we don't have a lot of data nationally on vaccinated cases that end up in the hospital. The state of Massachusetts does, King County, Washington publishes it, and the state of Michigan publishes. That's pretty much all I've been able to find. So I published some data because there's a lot of scary headlines. And the numbers I came out with that out of fully vaccinated in Michigan, your chances of ending up in the hospital are 0.005%. They're not zero, but they're very low. Does your anecdotal study of your own hospital, your patients, indicate that if you're vaccinated, yes, you might get a case, but your outcome is likely to be good? What are you seeing, doctor?
Thank you so much for having me. So yes, it's very much the case that we are seeing many fewer people who are fully vaccinated come to our emergency room with COVID-19 symptoms and certainly be admitted and certainly die from COVID-19. We have a few cases over the last few weeks where folks unfortunately were positive for COVID-19, admitted and died despite having been fully vaccinated. But the chances of that are much, much lower if you are fully vaccinated. So it's very important to caveat all of our concerns around breakthrough infections and waning immunity with that fact. However, if you are overweight, if you are older, if you have comorbidities, that risk of actually having a much worse outcome if you contract COVID-19 is greater. And that's the profile of folks we're seeing admitted to the hospital now, despite being fully vaccinated with COVID-19.
Yeah, and it's a hard thing to talk about on TV, and I'm just going to tell you it straight up, doctor, because you don't want to seem cold. I don't want to come off as cold or dispassionate. I have elderly parents. I've got a 93-year-old uncle who's been in and out of the hospital. I want everybody's family to do well, but I do wish that for the public's sake, we got more knowledge. By the way, the CDC doesn't publish any of this data anymore for whatever reason. Only some states do. That we got more demographic information with that, because there's a lot of people who read about the headlines, and in my industry, I admit it, it's a big, scary headline. Oscar De La Hoya vaccinated, really sick. So you think everybody's getting really ill. Can we do a better job of at least explaining to people, yes, there's risk, but if you're 89 years old or severely overweight, it's not, I don't want anybody to get sick, but there's other risks out there. You see what I'm trying to say without sounding cold or even mean?
Well, I think it's a really important question. What are the risks that actually make you much greater likelihood of being admitted or having a severe case of COVID-19 despite having full vaccination? And it's the usual suspects, according to what we're seeing in our hospital. One important point to mention is that there isn't necessarily standard reporting across the country on even the vaccination status of people being admitted with COVID-19 now. And so that's why the data you're seeing reported nationally isn't as detailed as you would like. I think the broader point, though, is that we need boosters. I think we're seeing more breakthrough cases in our hospital throughout the state of New Jersey. And while 75% of folks hospitalized are unvaccinated, that means 25% or so have at least one dose of a vaccine. That is a greater rate of hospitalization for fully vaccinated people now than even just a couple of months ago. And I think the conversations happening nationally around boosters couldn't happen at a better time. I think we need it. I think in particular, the elderly in our community here in Newark and folks with comorbidities, as we've been talking about, need a booster, and it can't come soon enough.
Yeah, and again, I'm not a doctor. I do dive into the data pretty deeply. I don't want to make any assumptions, but it does look like if we look at Israeli data, maybe UK data, some of our early data, and maybe the reason that we are seeing so many people that are very old or have severe comorbidities that are suffering the most because they were the first ones to get the vaccine, Dr. Elnahal. Would you agree with that? So they might have gotten their second shot as early as January. So it's kind of looking like an 8-month timeline toward reduced antibodies a bit. Would you, again, you're the expert. Would you agree with that?
Well, what we know from press releases and from company statements is that the companies assert that 6 months is really the time that you should get a booster. But I do think the federal government is going to go with 8 months, and they're going to start sequencing it based on the actual data submitted to the FDA. So I think what we'll see later this month, most likely, is that an approval or authorization rather for a Pfizer booster will come through. I do hope that Moderna comes soon enough, or at least that the FDA and the CDC think about allowing folks who didn't take Pfizer the first time around to take it for their booster so that we can vaccinate especially the vulnerable folks in our community sooner rather than later with that third shot. And so I do think that in conjunction with the Delta surge, the fact that we now have a version of COVID-19 that is more than twice as good at spreading from person to person than the original virus that filled up my hospital about a year ago, more at this point, is concerning. And I think that really speaks to, I think, the urgent need for a booster.
And are you seeing less reticence to get the shot? We actually have seen national vaccination numbers almost double off their July lows, Doctor.
We're seeing folks get vaccinated every single day in our community, and we're going out in our community and going door to door, canvassing, having the conversations around side effects and some of the misinformation that folks are seeing on social media, and still getting folks to show up to these mobile vaccination events all of this time later. And so I think it's important to understand that the essential task of vaccinating the unvaccinated at this point has never been more important. The whole concept of herd immunity relies much more on additional people who haven't gotten the vaccine yet to do so, rather than the task of giving a booster to folks. And so I think that's a really important point to make.